Hi, I'm Lillian Natal. I'm an educator and a survivor of childhood sexual abuse, and I'm here to speak to you today about cancer screening for survivors like myself. Cancer screening rates for survivors of childhood sexual abuse are lower than the norm, and it's no wonder. When you think about it, what happens during screening for colon cancer, breast cancer, and cervical cancer? Well, our breasts are squeezed and objects are inserted into our vagina and our butthole, like when we were kids being abused. So it's no surprise that we aren't lining up for this procedure. The Canadian statistics indicate that over 30% of your female patients are probably survivors of childhood sexual abuse. In January 2014, as part of a University of Toronto study on cancer screening, I interviewed women across the country. I had the privilege of talking to women in rural areas, urban areas, women who are white, non-white, women from all walks of life, and who have all levels of education. And they spoke to me about what helped them go get screened for cancer and what prevented them from going. What we found is that the relationship these women have with their doctor, nurse practitioner, their lab technicians, support staff, volunteer staff, everybody involved is of paramount importance. Even small things like a smile and eye contact can make all the difference. What we found is that patients need to feel respected and not like a piece of meat, the way they were when they were kids being abused. And the way they feel respected is when your focus is on them, when you're listening to them, when you're not looking at the computer screen or shuffling papers, when you're sharing with them. Without exception, the women I interviewed talked about the need not to feel rushed. And even when the appointment is brief, if your focus is on them, they don't feel rushed. It's very important to keep the room warm. When women have been repeatedly abused as children, they were often, after being humiliated, left lying alone and naked in a cold room. So being cold makes it that much more difficult to be touched. When you give your patients dignity, the experience is that much more positive. Keep the patient covered with a blanket throughout the procedure and let your patient know that you're going to move it before doing so. Control is a big issue for survivors because when we were children, horrible things were done to us and we were helpless. So you can give your patients control by offering them a choice. Even something like, do they want the speculum to be warm or cold, can be really helpful. You can demystify the procedure by explaining what you're doing to your patient and by describing the instruments, naming them, and saying what you're using them for during the procedure. It's so important just to be human with your patients. That changes the whole situation, makes it something that's happening person to person. It's okay to laugh, smile, joking, sharing something about yourself, maybe a time that you were nervous about a medical procedure, can really make this a person-to-person interaction. When it comes to asking about abuse history, there is no consensus. Some patients appreciate it, others find it intrusive. However, if you treat all of your patients as if they were sexual abuse survivors, you can't go wrong, because what's good for abuse survivors is good for all patients. What I found most encouraging in my interviews with these women was that even one positive experience with a healthcare provider affects how the women feel about all healthcare thereafter, including cancer screening. It allows them to have a more positive expectation and attitude towards it. We want to be healthy, and you want us to be healthy. We're partners in this process. So I want to end by thanking you for being here with me today.